Hi friends, once again welcome back to the Nurse channel. Today we have come with another set of questions that will prepare you for the upcoming nursing officer examinations. So as you all know, there is a news like we can expect the AIIMS NORCET examination, the next AIIMS NORCET examination in the coming September-November months. So and moreover we are expecting the ESIC exams, JIPMER exam and also the SCTIMST exams also. So as you all know, we have already started our preparation for the SCT, IMST and JIPMER exams, which we have uploaded so many videos. So this is an addition, like we are make you to prepare for the upcoming AIIMS NORCET examinations also. Okay, so we have limited time in front of us, like 2 to 3 months. So I request everyone to watch this video, kindly support and kindly be in touch with our video so that we can prepare well for the upcoming nursing officer examinations. And you all know that there are so many examinations are in queue. So once again, welcoming you all back to our channel, and whoever didn't subscribe our channel, kindly subscribe and support us. So straight away we will move on to today's set of questions that will equip you to prepare, equip you to deal with the nursing officer exams for the AIIMS NORCET, ESIC, JIPMER, etc. Okay, so we will move on to the questions. So we'll move on to the very first question in our series today. So it's a general question, and we all are using gloves in our daily clinical setting. So the question is, which among the following is used as a dusting powder in surgical gloves? So the question is, which among the following is used as a dusting powder in surgical gloves? And the options for you are: option number A, boric acid powder; option B, talcum powder; option C, zinc powder; option D, lactulose powder. So which powder is used as a dusting powder in surgical gloves? So the answer is option number A, boric acid powder. Okay, so boric acid powder is used as a dusting powder in gloves, and it is a natural antiseptic. Okay, it can be used as a cleaning agent. It is an antiseptic, and it is also used as an astringent. Astringent means are substances which can cause the shrinkage of our cells. Okay, so in the medical uses include that in the cosmetic treatment, like the pores closing, those things. Okay, the cell shrinkage will happen with the help of boric acid powder. So it is an astringent and it is an anti-fungal agent. Okay, so it can be used in the treatment of vaginitis and all, and it is an ingredient in the homeopathic medications. Okay, so these all are the uses of the boric acid powder, and the daily use of it is in the daily clinical settings is it is using as a dusting powder in the surgical gloves. Okay, I think the first question is an informative question for you. So now we will move on to the second question, and the second question is from the central nervous system, and it is related to a condition called GBS, or the Guillain-Barré syndrome. So what is the first line treatment of Guillain-Barré syndrome? So what is the first line treatment? So question should be very careful. You read the question very carefully. What is the first line treatment of GBS, Guillain-Barré syndrome? And the options for you are: the first option is heat therapy, the second option is immobilization, the third option is corticosteroids, and the final option is intravenous immunoglobulin. So which is the first line treatment of Guillain-Barré syndrome? So definitely I think the answer is clear for you. Some confusion will be there in the options, but the answer is option number D, that is intravenous immunoglobulin. Okay, so we will see what is an intravenous immunoglobulin and how it helps in the prevention of preventing the worsening the symptoms of Guillain-Barré syndrome. So intravenous immunoglobulin, or IVIg, is a therapy which is the primary infusion treatment for the patients with Guillain-Barré syndrome. Okay, so along with that, plasma exchange also is it comes under the first line treatment, but in all hospital settings there won't be the facility for the plasma exchange. So if you are getting the immunoglobulin, intravenous immunoglobulin, we can transfuse in any clinical settings. Okay, so we know that the IVIg delivers donor plasma, okay, donor healthy plasma to the body's bloodstream, okay, to the patient's bloodstream through an IV. So the healthy immunoglobulin contains antibodies that will fight against and dilute the GBS antibodies responsible for harming the body's nerves. Okay, so I'm not going in depth about what is the GBS and all, so you can go through that. So what is happening is the immunoglobulins will be washed out or will be cleared with the donor's immunoglobulin, antigonous immunoglobulin, which contains the antibodies that will fight against the GVS antibodies, okay, which are responsible for harming the body nerves, okay. So IVIg stands for the first line treatment for the treatment of first line management for the treatment of GBS, okay. And we will see the other options also. The other options, the first one is the heat therapy. So heat therapy will help relieve pain but does not have the benefits of plasma exchange, okay. So it will relieve the pain but it does not have the benefits of plasma exchange. So the second another option was immobilization. So immobilization should be avoided in patients with GBS because as it can cause contractures in the patients, okay. So it can result in contractures, so immobilization should be avoided. And another option was regarding corticosteroids. So corticosteroids, if you are giving to the patient, it may worsen the patient's outcome, okay. So these are the other options and the explanation for that question. So that question also from the central nervous system also was helpful for you, I believe. Now we will move on to the next question in our series, the third question. So the question is, which of the following is the most common cause of abdominal aortic aneurysms? Okay, so the most common cause of AAA, abdominal aortic aneurysm, is the question, and the options are: option number A, post-surgical anastomotic disruption; option number B, cystic medial necrosis; option number C, atherosclerosis; and the final option, vasculitis. So among these, which is the most common cause of abdominal aortic aneurysm? That is the question. So the answer is option number C, atherosclerosis. So atherosclerosis stands for the primary reason for the development of AAA, and it is the most common cause of weakening of the arterial wall. Okay, so you know that aneurysm is the outpouching of the arterial wall as a result of the weakening of the walls. So the atherosclerosis stands for the most common cause, and the other causes which include infection, trauma, arteritis, that is inflammation of the arteries or the infection of the arteries, then cystic medial necrosis, alcoholism, smoking, hypertension, etc. Okay, so these are the other causes which can result in the development of AAA. Okay, infection, trauma, arthritis, cystic medial necrosis, alcoholism, smoking, and hypertension. Okay, so I think that question also is clear for you. Now we will move on to the fourth question in the series, and this is a picture based question, and in the NORCET you can expect picture based questions, and the question is, identify the mask. Okay, I have shown you in the screen a mask. You have to name the mask. Okay, and the options for you are: option number A, bag valve mask; option number B, Venturi mask; option number C, non-rebreather mask; option number D, ampoule bag. So name the mask I have shown in the picture. So the answer is, it's a non-rebreather mask. Okay, it is a non-rebreather mask. You can see the picture of non-rebreather mask in the screen right now. And this non-rebreather mask, or the NRB, or the non-rebreather or non-breather face mask, etc., it is a device used in the medicine to assist in the delivery of oxygen therapy. Okay, so and the NRB allows for the delivery of higher concentration of oxygen. Okay, the higher concentration of oxygens can be delivered with the help of this non-rebreather mask. Okay, so I am not going in depth about this mask. You can refer. So here was one reservoir will be there. So this will be pre-filled with the oxygen, and this will have a connection also, and that oxygen from the oxygen plant or from the oxygen cylinder, and the oxygen will be collected here, and this oxygen will be available for the patient through this mask. Okay, so that is a non-rebreather mask, and because it has a collection of oxygen, only the oxygen, it can deliver the higher concentration of oxygen. Okay, so that is a non-rebreather mask, and you can refer in which all situations, in which all conditions non-rebreather mask is useful. Okay, so now we will see the other options. Okay, the other option was the bag valve mask. Okay, so this is a picture of the bag valve mask. Okay, so whoever worked in the clinical settings can identify this mask, and this is a valve mask, bag valve mask, or the BVM, sometimes known by the proprietary name, that is ampoule bag. Okay, the regular ampoule bag, or generically as the manual resuscitator or self-inflating bag. It is a handheld device commonly used to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. Okay, so this is an ambu bag, you know what is the use, and another name is the bag valve mask or the self-inflating bag or the manual resuscitator. Okay, it will provide the positive pressure ventilation who are not breathing or their breathing is less, okay, not adequate. So that is the bag valve mask. Now we will see the another option, that was a venturi mask. So this is the picture of the venturi mask. You can see a connector here. Okay, so the venturi or the air entrainment mask, it is a high flow device that delivers a fixed oxygen concentration of 24 to 50%. Okay, 24 to 50%. So this will be useful for patients with COPD and all. We know that higher concentration of oxygen cannot be given for those patients. So if you want to limit the oxygen concentration and we have to limit the amount of oxygen that to be given to a patient, we can use this venturi mask or the air entrainment mask. Okay, it will deliver the oxygen concentration of 24 to 50%. Okay, so now we will move on to the another question in our series, that is the fifth question, very important question. The major anticoagulant used in the blood product collection and storage. So the question is, which is the anticoagulant which they are used in the blood storage centers and the blood collection bags? Okay, so that is the question for you, and the options are option number A, EDTA, that is ethylene diamine tetraacetate. Option number B, citrate compounds. Option number C, heparin. Option number D, warfarin. So which is a major anticoagulant which is used in the production, used in the blood collection and storage? So the answer for you is option number B, that is citrate compounds. Okay, citrate compounds. So the explanation we can see a little. Acid citrate dextrose is the most common. It is a citrate compound. Acid citrate dextrose is the most commonly used anticoagulant to store the blood in the blood banks. Okay, so the citrate compounds, how it will work is, citrate binds to the free calcium and it prevents it from the interacting with the coagulation system. Okay, so the citrate will bind to the free calcium and it prevents it from the interacting with the coagulation system. So acid citrate dextrose, it is the most commonly used anticoagulant in blood banks. And the other option, that is the ethylene diamine tetraacetate. You know that it is we have the vacutainers with EDTA. So it has been used for the hematological test. Okay, because the blood cells are preserved better in the EDTA sample. So for the pathological investigations like complete hemogram and other pathological investigations, we need to collect the blood sample in a EDTA container. Okay, that means it will prevent it from the clotting. Okay, not for the blood collection bags. Okay, so the other two options were the heparin and warfarin. That you know that heparin and warfarin are not used in the blood clotting in the blood product systems. Okay, heparin usually for the dialysis and all, and for the other it is a low molecular weight heparin can be used in the other settings, and warfarin is an oral anticoagulant. Those things you know very well. So our answer is citrate compounds. Okay, now we will move on to the next question in our series, that is regarding the sleep cycle, and the question is, REM sleep is also known as. So the question is the other name for REM sleep, otherwise known as the rapid eye movement sleep. So the options for you are option number A, slow wave sleep. Option number B, deep sleep. Option number C, paradoxical sleep. Option number D, all the above. So what is the answer for this question? REM sleep is also known as. So the option is not D, it is option number C, that is paradoxical sleep. Okay, paradoxical sleep is another name for REM sleep, and we know that sleep is divided into two broad types. That is, one is the non-rapid eye movement or non-REM or NREM sleep, and another classification, another part is the rapid eye movement sleep or the REM sleep. So the non-REM sleep occurs first. Which occurs first? Non-REM sleep occurs first, and after a transitional period which is called as a slow wave or the slow wave sleep or the deep sleep. Okay, so slow wave sleep or the deep sleep, then comes a non-REM sleep, and then comes the REM sleep. Okay, so REM sleep is also known as the paradoxical sleep, and it represents a smaller portion of the total sleep time. Okay, so it is a smaller portion of the total sleep time, and it is the main occasion for the dreams or nightmares. So this is a regularly asking question. So nightmares or the dreams can occur in which stage of sleep? Okay. And this REM sleep is associated with desynchronized and fast brain waves, eye movements, loss of muscle tone, and suspension of homeostasis. Okay, so suspension of homeostasis can happen in which stage of sleep? This is also the another question we can expect, and this will all things will happen in rapid eye movement sleep, which is the last stage of the sleep, and it is of a minimum smaller, it is a smaller portion of the total sleep time. Okay, so that's all about that question. Now we will move on to the next question. That is the seventh question from our NORCET series. So the question is, which among the following is a natural sedative? So the question is, which among the following is a natural sedative? So the options are: option number A, flurazepam; option number B, temazepam; option number C, tryptophan; option number D, lorazepam. So what is the answer? Flurazepam, temazepam, tryptophan and lorazepam. So what is the answer? Which among the following is a natural sedative? So the answer is option number C, that is tryptophan. Tryptophan is the answer for this question. So we will see what is tryptophan and what contains tryptophan. Okay, so tryptophan is an amino acid that promotes the sleep, and it is found in small amounts in all protein foods. Okay, so especially milk and milk products. Okay, that is the reason milk can be given for the patients at bedtime, during the bedtime, to have a peaceful sleep. Okay, so tryptophan contains in almost all protein foods, and it is abundantly found in the milk and milk products. Okay, so it is a precursor to the sleep producing compounds like serotonin, it is a neurotransmitter, and melatonin. So it is also a hormone which also acts as a neurotransmitter. Okay, so this tryptophan is acting as a precursor for serotonin and melatonin, and these are the sleep producing compounds. Okay, so I think that question also is clear for you. So in another way you can expect a question from this area, that is why milk we are giving for the patients at bedtime. That is because it is the presence of tryptophan which can induce sleep. Okay, so how it induces sleep we have already explained. So now we will move on to the eighth question in our series. So this is also a confusing question, so please be careful. So the question is, IV line infiltration involves. The question is regarding IV line infiltration. Okay, so the options are: option number A, swelling and pallor; option number B, erythema; option number C, drainage; and option number D, bleeding. So the question is only regarding IV line infiltration. Okay, so in IV line infiltration, what all things can be seen? Swelling and pallor, erythema, drainage, bleeding. So what is the answer? So the option is option number E, swelling and pallor. Okay, so this is the first stage of the phlebitis or the thrombophlebitis. Okay, so there will be IV line infiltration will be there, and it will be evident like the infiltration would result in swelling. So first there will be swelling will be there, and then pallor will be there, the color change will be there, and there won't be erythema near the insertion site. Okay, there won't be erythema. So the another option is omitted. So tenderness, warmth, swelling, and in some instances a burning sensation are the signs of phlebitis. Okay, so the other options what we have given is the signs of phlebitis, like tenderness will be there, warmth will be there, swelling, definitely in infiltration also swelling will be there, and in some instance a burning sensation. These are the signs of phlebitis, and if it is become infectious, then drainage may happen. Okay, so the drainage, and this was another option, so drainage may indicative of infection. Okay, so that's all regarding the IV line infiltration and its signs and symptoms. Moving to the 12th question in our series. So the question is from the ICU. The question is, one ampoule of dopamine contains how many milligrams of dopamine? Okay, so who are working in the ICUs and in the ICU, who wants to work in the ICU should understand about this injection. This is very, very important. One ampoule of dopamine contains how many milligrams of dopamine? And the options are: option number A, 50 milligram per ml; option number B, 40 milligram per ml; option number C, 30 milligram per ml; and option number D, 20 milligram per ml. So dopamine in cardiac ICUs and all, it is a very, very important drug. So what is the answer? So the answer is option number B, that is 40 milligram per ml. Okay, so one ampoule of dopamine contains 40 milligram of dopamine, in 1 ml, and it is usually comes as a I think it is a 5 ml ampoule. So 5 4 are 20, 200 ml, 200 mg dopamine we can get from 1 ampoule of dopamine. And regarding that medication, it is a medication which is most commonly used in the treatment of very low blood pressure, a slow heart rate that is causing symptoms, and if epinephrine is not available, and it is also used in the cardiac arrest. Okay, so it's a medication which is commonly used for low BP, bradycardia, and with the symptoms, and in cardiac arrest if epinephrine is not available or it cannot be used, okay, in such cases. So at low doses, it can be given in low doses and high doses. So low doses, it acts through the sympathetic nervous system, and it will increase the heart muscle contraction force and heart rate, and thereby increasing the cardiac output and BP. Okay, so low doses means it will be acting as a sympathetic nervous system in the sympathetic nervous system, and it will increase the heart muscle contraction, and it will increases the heart rate, and thereby increasing the cardiac output and thus the blood BP. And higher doses also causes vasoconstriction, and that can further increases the blood pressure. Okay, so based upon the patient conditions, the low dose can be fixed. Okay, so that's all about the injection dopamine. Okay, now we will move on to the next question in the series, that is 13th question in our series. The question is, what is the standard site for insertion of a chest tube? Okay, so this question is regarding the intercostal drainage, ICDs. So the question is, what is the standard site for the insertion of a chest tube? And the options for you are option number A, 4th to 5th intercostal space, the option number B, 6th to 7th ICS, option number C, 8th to 9th ICS, and option number D, 10th to 11th ICS. So what is the standard site for the insertion of the chest tubes? So definitely the answer is option number A, that is 4th to 5th intercostal space. Okay, 4th to 5th. So here I am inviting your attention to a picture here. So you can see a picture here, and the patient is lying down with the affected arm resting over the back. Okay, so this should be the position that we have to give for the patient in for the insertion of the chest tubes. And you can see that this is the lateral edge of the pectoralis major muscle, and this is the 5th intercostal space, and this is the lateral edge of the latissimus dorsi. Okay, and this is the base of the axilla. So we can form a space here, and from here we can insert the tube. So the 4th or the 5th intercostal space in the mid to anterior axillary line. Okay, from the mid to anterior axillary line, just lateral to the nipple in the males, which is immediately behind the lateral edge of the pectoralis major. Okay, so this is the lateral edge of the pectoralis major, and just here comes the nipple if it's a male patient, and it should be inserted here. So I'm giving you some another information, like if patient is having pneumothorax, how we have to advance the tube. If patient is having hemothorax, how we have to advance the tube. These things, okay, that we can see in the next explanation. We have to direct the tube as high and anterior as possible for a pneumothorax. Okay, so it has to go high and anterior for a pneumothorax, and for a hemothorax the tube is usually inserted at the level of the nipple and directed posteriorly and laterally. Okay, it should go posteriorly and laterally for a hemothorax patient, and for a pneumothorax it should go high. Why high? Pneumothorax means air will be collected in the upper part. Okay, so we have to position the patient like they elevate the head of the patient 30 to 60 degrees and place or restrain the arm on the affected side over the patient's head, that we have seen in the picture. Okay, so I think the insertion site, how to insert and where to insert is clear for you for ICD people. Okay, so this is the lateral edge of the pectoralis muscle, and we have to go high in case of pneumothorax, and we have to go at the level of the nipple in case of hemothorax. Okay, so that's all about the ICD site and ICD insertion. I think that also is a very good question. And now we will go on to the second last question in our series, and the question is, which is the drug of choice for pregnancy induced hypertension? Okay, this is also a very important question. So if a patient if a lady is having BP during her pregnancy period, so which will be the drug of choice? First drug of choice, that's the question. So the options are option number A, labetalol, option number B, nifedipine, option number C, amlodipine, option number D, methyl dopa. And the most funniest thing in this question is all these drugs can be used and they are safe in the pregnancy, but which is the drug of choice for patients with hypertension during their pregnancy period? So what is the answer? So the answer is option number D, methyl dopa. Okay, methyl dopa is the drug of choice, and it is a drug of first choice for the control of mild to moderate hypertension in pregnancy, and it is a centrally acting sympathomimetic. Okay, it is a sympathomimetic drug. So we will see some other drugs also that is a safe antihypertensives in pregnancy, which include, the first one is a methyl dopa. First stands the methyl dopa, then comes nifedipine. Nifedipine, it is a calcium channel blocker, and then the labetalol. Labetalol is a beta blocker. Okay, we can't use all beta blockers or the all calcium channel blockers. So some medicines are there. In that, methyl dopa comes first, then comes the nifedipine, and then comes the labetalol. Okay, nifedipine, calcium channel blocker, labetalol, beta blockers. Okay, so now we will move on to the last question, the very last question in our series, and this is from the community health nursing, and the question is, cold stage, hot stage, and sweating stage, these are the stages of which disease? Okay, the question is, cold stage, hot stage, and sweating stages are stages of which disease? And the options for you are option number A, dengue, option number B, typhoid, option number C, malaria, option number D, TB. So what is the answer? So the option number C, malaria, is the answer for this question. So we will see these stages in brief, very briefly we will see. So the malaria paroxysms comprises of 3 successive stages, and this include, the first stage is a cold stage, and it is a 15 to 60 minute stage characterized by shivering and a feeling of cold. The patient will be shivering very badly, and there will be feeling of cold. That's why it is called as a cold stage. This is the first stage, which lasts about 15 to 60 minutes. Then comes the second stage, that is a hot stage. It is a 2 to 6 hours duration stage, in which there is fever will be there. Hot stage, fever will be there, sometimes reaching up to 41 degrees Celsius, and patient will be flushed, dry skin, and headache will be there, nausea and vomiting will be there. Okay, so these are the characteristics of the hot stage. Cold stage first, then comes the hot stage, that is a febrile stage, then comes the last stage, and it is the sweating stage. It is of 2 to 4 hours duration, and during this stage the fever will drops rapidly and the patient sweats. Okay, so that is a peculiarity of the last stage. Okay, so cold stage, hot stage, and sweating stages are the successive stages of the malaria paroxysms. Okay, so regarding the dengue, already we have explained in the old session, so whoever didn't watch that video, kindly go through those videos. Okay, so here we are coming to the end of the session. This was a session for the NORCET preparation, and I think these all 15 questions what we have discussed today is very important for you, and I thank each and everyone who watched the video till the end. And again, I request you people to kindly share about this platform to your nursing friends and kindly support us. So once again, thank you for watching the video. So we will be coming back with another set of questions very shortly. Till that time, see you, keep in touch.